Anxiety and Depression Association of America, or the ADA's website, 18.1% of adults suffer from anxiety, with it being the most common mental illness in the United States. That's approximately 40 million adults per year. Healthline states that depression affects 6.7% of American adults, or approximately 16.2 million of them. The ADA website also states that about half of all of those who suffer from depression also suffer from an anxiety disorder. I'm sure some of you know people who suffered or have suffered from anxiety or depression, as these are on the rise in today's society. My goal is for you to become more aware of these illnesses so that you can live mentally healthier lives and help those around you do the same. Today I will talk about how anxiety and depression affects people, steps that can be taken to help treat it or help relieve its symptoms, and help you imagine a world where these illnesses continue to rise. First, let's talk about symptoms of anxiety and depression and their complications. Mayo Clinic and Healthline's 2018's websites list some symptoms of anxiety and depression, including feeling nervous, restless, tense, having an increased heart rate, social isolation, heavy breathing or hyperventilation, sweating, trembling, trouble concentrating, extreme irritability over seemingly minute things, loss of interest in activities, fixating on the past or past wrongs, and thoughts of death or suicide. Physical symptoms include fatigue, which can oftentimes be debilitating, insomnia or oversleeping, an increase or decrease in appetite or weight, and unexplainable aches and pains. Those with an anxiety disorder may also experience complications such as depression and other mental health illnesses, substance misuse, insomnia, problem functioning in everyday life such as at school or in work, and a poor quality of life, according to Mayo Clinic's website. Many complications of depression are similar to those of anxiety, including substance abuse, trouble with school or work, and social isolation. However, Healthline also states that some other complications of depression include phobias, panic disorders, anxiety attacks, family and relationship problems, excess weight or obesity due to eating disorders, which may also increase the risk for other illnesses such as type 2 diabetes or coronary problems, and self-mutilation. Attempted suicide and suicide are also a common complication for both illnesses. As a matter of fact, 30 to 70% of those who have committed suicide suffered from depression or bipolar disorder, and according to the National Institute of Mental Health's website, it was the 10th leading cause of death in the United States in 2016. To help gather perspective on things, there were over twice as many suicides as there were homicides in that year, with almost 45,000 people dying from suicide and only 19,362 dying from homicide. Mental illness such as depression and anxiety disorders can be debilitating, so it is important to keep in mind that they are illnesses and should always be regarded as such. Now, let's talk about possible solutions to treat or lessen the symptoms of anxiety and depression. One solution is to eat right, exercise, and get better sleep, and encourage those around you to do the same. WebMD's website states that cutting down on foods and drinks which contain caffeine can help relieve symptoms of anxiety, as caffeine is a mind-altering drug. This includes things such as coffees, teas, energy drinks, and chocolate. Many different aerobic exercises, especially those such as biking, swimming, and jogging, aid in the release of many brain chemicals which can also cut stress and may improve these symptoms. Although insomnia is a symptom of both anxiety and depression, getting a good night's rest and following relaxing bedtime routines are vital when it comes to helping them. Over-the-counter medications or prescription medications can help with this insomnia. However, you should always make sure to talk to your pharmacist or your doctor before taking them, as they may worsen some symptoms while trying to improve one. Knowing the warning signs is also another solution. Mayo Clinic's website states that getting help early helps treat the illnesses, as like most illnesses, the longer you wait, the harder it may get to treat. Both clinical depression and anxiety disorders are treatable though. It's just a matter of recognizing the symptoms and getting the help that you need. Knowing the signs may also help you recognize them in those around you and get them the help that they need. This is especially helpful when an individual don't know the signs themselves and are not seeking the help even if they know they need it. Psychological counseling and anxiety medications or antidepressants may greatly help the chances to treat these illnesses as well. Although most effective together, they may be done alone without each other, and still prove effective. However, according to Healthline's website, psychotherapy has a much lower rate of relapse and had lower dropout rates than medication did. Next, let's talk about the future. These mental health illnesses also bring along physical issues. The Everyday Health website states, in a study by health insurance company Blue Cross Blue Shield, the rate of major depression diagnoses swelled by 33% from 2013 to 2016 and is continuing to climb rapidly. It showed that depression rates were highest among individuals aged 10 to 19, which having it be 63%, and 47% for millennials, or those aged 20 to 37. Major depression and anxiety also affects people's health. The Blue Cross Blue Shield report showed that 8 out of 10 people who lived with major depression also suffered from one or more serious chronic health issues. According to Harvard Publishing's website, treating anxiety can oftentimes improve the outcomes of chronic diseases such as gastrointestinal tract problems, heart disease, and respiratory illness. A 2007 New Zealand study discovered a relationship between high anxiety levels and the development of irritable bowel syndrome following a bowel infection. Many studies have also shown that high rate of anxiety symptoms and panic attacks in patients who have chronic respiratory disease. Men and women suffering from an anxiety disorder with an established heart disease were also twice as likely to have a heart attack than those who had no history of them. If the rates of depression and anxiety continue to rise, so will the rate of suicide and attempted suicide. According to the National Center for Biotechnology Information's website, over 70% of individuals who reported a lifelong history of suicide had an anxiety disorder. According to Yoshitomo Takahashi, the chief of Department of Suicidology at the Tokyo Institute of Psychiatry, in the Japan Medical Association Journal of 2001, suicide rates among patients suffering from depression is at least several times higher than those who don't. 60 to 70% of those who committed suicide have shown to be depressed before taking their lives, and 1 in 6 patients who suffered from major depression died by suicide. Today, I talked about depression and anxiety disorders. I also discussed these illnesses as growing problems which could be helped by knowing the signs of them and how they can be treated. My hope is for you guys to become more aware of the illnesses so that you can live mentally healthier lives and help those around you do the same. Many steps can be taken to do this, such as eating right, exercising, getting better sleep, psychological counseling and medications, knowing the symptoms and its possible consequences. I would also like to end my speech with a quote by Confucius. It does not matter how slowly you go, as long as you don't stop. Thank you.